but what's not realized is that mental health is just as important. So in terms of my career, I'm not sure in what type of psychiatry I really want to pursue as of yet. It's just as important. I used to work with kids. I played golf growing up, so I used to work for this organization called The First Tee, and basically they incorporate
White. I'm a registered nurse, family nurse practitioner. I have a long background in psychiatry, working with juveniles, working with substance abuse, working inpatient, working outpatient, being on the floor, and also in a leadership role. I actually entered the family medicine side due to the fact that most of the people with mental health treated or getting the proper care, physical care. That's the interest that started this whole process of me entering the field of being a family nurse practitioner. While I was there, I treated those that's on Suboxone, Vivitrol for alcohol withdrawal. So my specialty, my area of focus has always been the community less served. I am Jamaican born, been here since a kid, 12, 13 years old. So I'm here, glad to be a part of the panel and looking forward for the discussion.
Perfect. So we're going to jump right into it, right? And ladies and gentlemen, as mentioned before by Corey, with you, those of you who are out there, please, if you have questions, please shoot it in the chat, and we'll make sure that those questions,
it's 11 o'clock.
Right, those questions are answered for everyone. So looking forward to hearing from you. So let's just jump right into the questions that are out there. Question, tell us very quickly, and I'm going to start with you, Courtney. What are the differences and similarities in your purview, the overall differences and similarities between mental health and mental illness?
Oh, that's good. So, according to the CDC, right, mental health, right?
I got to stop you for 1 second. Just remember, everybody don't know acronyms, right?
I'm sorry.
Everyone should know CDC. So I'm gonna check ground rules, right, for everyone. I do that when I was in administration. I love to use acronyms because it's familiar to us. So if you're going to use an acronym, CDC is fine, but that just reminded me of that. So when we use terms, just make sure that the audience know what we're talking about when we use terms. But CDC is, everybody should know CDC. I forgot that. And that goes for all the panelists.
Yeah. So, Center of Disease Control. So I hope everybody's familiar with that during the last 2 years. However, according to their verbiage or language, is really affects that person's mood, their feeling, their behavior, how they make those critical decisions. One will say that, hey, I'm mentally stable, right? I have good mental health, right? But if I have experienced a death, some sadness, right? I saw something outside that I couldn't really do anything. How does that affect my decision? What happens then, right? So it affects the mental illness aspect, that deficit that we may have amongst ourselves to say, hey, I was unable to process and make the proper decision. So it's a very thin line when it comes to mental health versus mental illness. And both of us, each of us, all of us should be able to say, hey, at this particular time, I think I need some help because my decision making at this particular time is not really what I need to do. And I can identify some sort of stressor, right? It could be the fact that I want $1 billion, right? And that's a good stress, right? But then the self will have decision that's going to be made. And the individual at that particular time might become a little bit anxious. That anxiety itself can make that individual make a wrong decision, right? So we usually focus on those individuals that schizophrenia, those are persistently mentally ill, the guys that we may see on the street panhandling, but we forget about our own self, right? We may be a little bit anxious. The job itself is a little bit tedious. We're working remotely. We're isolated away from everybody because of the last pandemic. So those last 2 years, we see an increase in an individual that might be mentally ill due to the anxiety, due to the depression, right? So again, it's a very thin line. We all have to have insight in our own selves and recognize when we're struggling from one side to the next. Just like we have physical health, physical illness, the same way we should be looking at it from mental health and mental illness, that we all can be a part of that continuum.
Perfect. Very quickly, Khadijah, what does that look like when you, as in family therapy? What does that look like when you talk about adult adolescent? What does it look like when you talk about, especially mental health?
Well, first is even how I address my clients, because I don't even call my clients mentally ill. Because right now in the mental health field, we're even trying to change the wording so that way we know that it is not who the person is, it is something that they're dealing with. So with my adolescents, we personify whatever it is. And we say, no, you don't have a mental illness, you have a mental health disorder. And it's something that you're working through. So that is just one way that we make the distinction that you are not a problem, you are not an issue, you are not a sickness, you are dealing with this thing right now, and we will work through it and get through it. So like Courtney said, mental health is the status of your mental wellness. How are you taking care of it? So with my adolescents, how are you coping? Healthy or unhealthy? Are we cutting versus journaling? Are we acting out versus taking a walk? Are we punching walls versus verbalizing or expressing what the emotion is? So it looks very different for our adolescents because some consider it behavioral, but you never know that it's actually mental and they don't know how to work it out any other way than act it out.
Thank you. Our next question, I did see, Floretta, I did see your question in the chat, but we're going to come to that question in a little bit. In your practice, Ms. Rumi, in your practice, line of work, study, what do you see as the major barriers for people of color in getting adequate mental health care? Allison?
Yeah, so from my experience, a lot of it has been exactly what we've spoken about, the stigma. You know, parents that, you know, there may be some behavior issues, the parents say, not my child, there's nothing wrong. There's also not enough resources in communities of color. I know big states there is, and you see commercials and you hear a lot of good stuff from a lot of politicians, and but there really isn't. I mean, it's all like in a sense hidden in
So I think that barrier, especially, like, if that can be addressed, can definitely help a lot of people.
All right, thank you. So what can mental health stigma look like for the Black community, right? So what can mental health stigma look like? And okay, so I'm gonna, each time that I realize that I'm saying Black community, and most of the individuals on the call are Black or Caribbean. So I want to look at it from the different angles, because you come across all of these different individuals in your field. So I'm going to start with Courtney. Courtney, so tell us, what can mental health stigma look like within a community? And let's, emphasize the Black, the Caribbean, and the general public. What does that look like?
So we can break it down how, for public, self, and this institutions, right? So the individuals themselves, right? If I'm being stigmatized, right? These people with mental illness, right? They're dangerous, right? They're incompetent. They're unable to do anything that we're telling them to do. They can't follow the laws, right? That's the public perception of what's going on with the mental illness. Then the individuals themselves might be like, hey, why should I try? Right? Why should I try if they already have this label on me that I'm dangerous, that I'm unable to process any information, that I'm no good? Why try? The issue is, if I did something, I'm going to jail because of my mental illness at that particular time. I'm not at my baseline, my normal state to really function and process the information. So then the institution itself will stigmatize them and say, hey, you don't deserve to be in a hospital. You deserve to be in a jail setting. And these individuals, you will see that as an increase of the incarceration rate for people with mental illness, as opposed to them being treated. We also see the fact that, they're just drug users, right? So we don't need to do anything for them. You see them panhandling, they're always drunk, they're always high. So that's their fault. Not knowing the fact that is a much more deeper chemical imbalance that's associated with the behavior of the individuals, right? So the stigma that we really see in the Black communities is the fact that the understanding, the education is lacking, and the individual themselves is being blamed for something that's not in their control most of the time.
Perfect. Ms. Dixon, what does that look like for you when you see that?
Well, looking at it within the Black community and in the Caribbean community, you see a normalizing of behaviors that are irrational. So I remember growing up and having, people that are acting out in a way, and that becomes an alias. Oh, well, I'm just mad, or this is wrong with him. But it's like, no, we can't normalize the fact that this person is doing these irrational behaviors, but we're not giving any type of resources or help. So it is stigmatized, but it's also not being addressed when we see it in our communities. So making therapy something that's positive and not negative. I've had a lot of clients come in and say, well, I don't want to tell you what's really going on at home because my mama said, if I tell you what happened, that you're going to tell somebody and we're going to get in trouble. And I have to let them know, look, I'm not here to get anybody in trouble with the law. I'm not here to get anybody taken away. This is a free space for you. So even the stigma of opening up and letting people know what's going on without the fear of being judged or any type of legalities coming against you is one of the main things that I see with my adolescent.
Ms. Rumi, same question. What are some mental health stigmas? What does it look like within different communities?
I mean, I agree with Miss Dixon. We had the same thing. It's the students are afraid to tell us what's going on. They're afraid what their community will look like. Will look at them. Their parents, they're scared of the reaction their parents might have. And some of the reactions are extreme. I had a student that, definitely he was having a mental health issue, a severe mental health issue, and he needed to be hospitalized. And the parent just sent him back to where they're from, like St. Lucia. So like to them, there was like, instead of getting him help, let's send him back home and they can help him. And that was a very big disservice for this child. I mean, I don't know what happened in the long run, but I can assume that nothing great, because he was really struggling mentally, mental health wise, you know, and when you're not getting the help that you need, it affects the community in such a way that people are ignoring. I mean, violence gets increased, homelessness gets increased, substance abuse gets increased, alcoholism, domestic violence. All these issues stem from untreated mental health issues. And that is increased in Black and Caribbean communities a lot of the times also because of social economics status. The view that people do have on the Black and Caribbean community, you know, like you said earlier, you know, that they are bad, that, you know, this is what they come from, why help, why reach out? But I mean, we need to start reaching out. We need to make every community safe. You know, it's no community is safe with extreme mental health illnesses that are going untreated. And this is generational of untreated mental health issues. Generations. It's not today, it's not yesterday, it's not tomorrow. It's years and years and years in the making that are, you know, we have to try to, you know, break that. We have to break that. We got to break into it and really help, you know?
Courtney, tell us from your angle as well.
And this will be the stigma of the mental.
Yes.
Okay. Now, just answer that question.
I'm sorry, you did. That question. I mean, yes, you did answer. So actually, let me move on to the next question. How do the following? So we're going to take them one at a time. So, you know, in church we call something called a popcorn testimony. So it's like a 30-second answer to each one of those. We're looking. Some of them overlap a little bit. So we're going to go in the same order. So we're going to start with Allison, then we're going to go to Khadijah, then we're going to talk to Chris, and then we're going to talk to Courtney. So like really fast, right? So listen to some of these things. It's basically look at it from whatever angle you want to look at it from, but give us like 30 seconds of an answer. And there are 7 of them, right? So I'm just going to tell you right now. How do the following affect mental health, right? And we're talking about both mental illness and mental wellness, right? So, because again, as we spoke before, there is a difference between mental, there's some overlap in this, like that Venn diagram where you have the overlap and then you have the external component of that diagram, right? So how do the following affect mental health here among individuals of color, the Caribbean, and you can answer it from any angle, all angles, but remember, it's a hot popcorn. Internal clock, 30 seconds. The first one is racism.
I mean, that's a big thing, you know, in the Black and Caribbean community, you know, they're worried about the police. They're worried about, you know, even when they go into school, a lot of times when they go into school, it's not people that look like them. It's not people that are teaching them. It's not people that, the doctors that are helping them, exactly what was stated earlier. You know, so there's just a huge part, a huge piece when it comes to that. And they internalize all of that. And again, that's generationally, it's years and years and years in the making.
Khadijah.
Okay, it's the lack of representation. So though the resources may be available, you may have individuals of color go into these facilities and are working with clinicians that are not culturally competent, right? That are harming the individuals just by how they address them, just how they, just even how they work with them. That in itself can cause an individual to never, ever want to get support from someone that doesn't look like them. So for me, racism is actually a big deal. Even the modalities that we use in therapy are whitewashed. So, you know, the way we describe mental health is whitewashed. So learning to add more color to our treatment so that our clients feel seen and heard.
Courtney.
I agree, right? And one of the things I would add is the fact that us ourselves, when they come in, not to treat them as a subclass, right? Because within ourselves, we treat people with a mental illness as if they're less than we are, right? And the same image that they may get from a person who's racist, we may get from a person, since we're from the Caribbean, is less of race, more of class, right? So we have to address the class component attached to the race. So yes, we need to make sure that we're speaking at their level and be able to understand what they're going through and making sure that we're educating them the place that they're currently at.
Dr. Johnson.
Yeah, I agree with most of the point. Pretty much all the points made. There definitely needs to be, especially in like mental health care field, more, representation among people of color. When you're a person of color experiencing like some sort of mental health illness, you're waking up every day in fear, either fear of, is wherever I'm going to go, like, am I going to be safe? And also fear of, just being accepted. And so, when you're put in a situation where you have to, well, when you're seeking out help, it definitely helps that, it definitely helps to find somebody, relatable. We as people, we like to be related to. And I think, that's a big part of, helping break some of these barriers.
Socioeconomic situations.
Yes. So depending on where you live, every mental health facility looks different. And if you go in poorer neighborhoods, if you go into a mental health facility, it's not really that nice and it's kind of scary. So let's say if you're a child or a person suffering from depression and anxiety and you go into it and it's kind of dirty, it's a little dingy, it's kind of dark, it's frightening, but then if you go into like a neighborhood that's, not nicer, but has more money, those facilities look completely different. It's welcoming, it's bright, it's cleaner. So I think in that point, when it comes to like poverty, I think we need to put those better resources in those areas as well. So it's more welcoming. People aren't scared to go, to go into a clinic for whatever it is, and meeting the person where they're at is very, very, very important. And also when it comes to paying for it, whereas some people can pay for private, which you get like better healthcare. And then some people have to go into clinics, which some people feel is not the best, but that's not always necessarily true. Every doctor, every person's got to start somewhere.
Khadijah?
This was actually one of the reasons why I left working inpatient, because you could even see with the type of insurances that the clients have and how long they're able to stay at the hospital. Where I would have a kiddo come in with Medicaid and they're like, you have 10 days to heal? How is that possible? Where else I get another client that comes in with TRICARE and they can stay 6 months. So even that disparity alone with insurances and how long they can get the help, or even availability, right? So, you have Medicaid? Well, we only have 10 Medicaid slots and they're all full. So it's just those things that really comes in and marginalizes individuals based on race, based on class. And it's a system that was not created to heal. It was a system that was created to continue to maintain whatever the dysfunction is. And it's just really sad for our community and how it breaks down when it comes to getting the help, wanting help, and receiving quality help.
Dr. Johnson, just switch up a little bit. Dr. Johnson.
Yeah, I think it's just all about resources. During my rotation, I can't tell you how many times where, there'd be a patient, who couldn't get proper treatment, just due to some sort of insurance issue. And as what Ms. Dixon was saying, you know, she's right. And, you know, it really just marginalizes people. And there just needs to be like some sort of system that can really just, you know, incorporate, you know, everybody, like no matter what your socioeconomic status is, and, you know, to get the proper help they need. Because these people growing up in poverty, what people don't understand is that, you know, your surroundings are a big factor of your mental health. Like where you grew up, who you grew up around with, and those things. And, you know, so already they're starting out with, I guess, not enough resources for themselves to even, you know, get the help that they really need. So there just needs to be some sort of, you know, change in the system that can really incorporate getting the proper type of help for these people.
Courtney?
Yeah, and you know, just to add, all great points, and I'll go back to what Alison said earlier. You know, with sending them the child back to the island. One of the things is the cost that it comes, the time that needs to be involved. And if I'm a parent that have a child that need help, that's a lot of days I might have to miss from work, right? There's a lot of money that costs that will be associated with this family that we are unable to actually now take that time out to kind of fulfill the need for this particular child. So the poverty issue that's surrounding people that has a mental illness is very, very, very detrimental to our health. Substance abuse will increase because of the stress that they're putting on. They're starting to self-medicate. The patients themselves will not take care of themselves. The family will also be affected by what's going on. So really the poverty that's in the community, better insurance will be a good key. Being in patients, I understand what Ms. Dixon stated, that patient that come in with certain medication that need to be given cannot be given, right, based on the insurance that they have. The inpatient aspect of the length of stay is also effective, even for those that come in for substance abuse. So the social economic class associated with poverty, that also needs to be addressed. And some of the things that we're doing here on this panel, having people that look like you and I having these open discussion, it's a way for us to make sure that these patients that we're having, they have a voice.
All right, so I'm gonna go. Next question: suspicion of going not racism causing the issue, but the other way around now, going to somebody that doesn't look like you. Or is it a good thing or a bad thing for some people? Alison.
I'm confused. Can you explain it again?
So when you look at suspicion of white doctors, right? Mm-hmm. So would it be more beneficial, less beneficial, going to somebody that looks like you, doesn't look like you? So the reverse way. So racism is, I guess, the system looking down at you.
All right, I understand what you're saying.
The reverse.
Yeah. I mean, I think as humans, we want to be with people that are like us, that look similar to us, who have similar struggles to us. That's just how we are inherently. So they may think, people coming to me, let's say, may think, well, she doesn't understand. She's not a Black woman. She's not a Black kid. She doesn't understand. You know, my mom has different disciplinary recourse than she might have had. So they may not be willing to share as much with me because they're scared, like I may call ACS or call the cops or look at them differently. So I feel like, you know, that is a barrier when asking for help in the communities and in schools also too, because I can say from schools, I worked in a school. So they may not be willing to reach out to me. You know, when I was in the juvenile lockdown facility, I mean, they didn't really have anywhere to go. So they really didn't want to talk to anybody who's willing to talk to them. So that was like a little different, you know. But in schools, like sometimes they don't want to talk to you. They're scared, you know, they're scared that I'm not going to relate to them. And majority of in all likelihood, I can't relate on the same level as other people can relate. You know, people of color, I can't relate. I'm not of color, you know, so I can only take it and I can only learn from other people as well.
Khadijah?
Thank you for saying that, Alice. And I really do appreciate you saying that, because I've worked in facilities where I was the only clinician of color. And you see how the individuals come in and how they gravitate to someone that looks like them. When it comes to suspiciousness of individuals, when it comes to white doctors, that is something that has been rooted in the Black and brown community. If we think about the Tuskegee Airmen, right, in Alabama, where their syphilis wasn't being treated and they were being used as an experiment, those fears are still rooted within the Black community. We think about Black and brown maternal health and how fearful we are to go and give birth at a hospital because our needs are not being met. This is all rooted in our clients when they're searching for clinicians, and those suspicions are still there. So definitely that barrier of not having clinicians of color is truly a problem, because if they don't see themselves, then that is going to add another layer of, well, I'm already feeling these things that nobody else around me knows. And then on top of it, I'm going to walk in and not see anybody that knows me. That adds even more of a distaste of wanting to get the help and assistance that you need. I've had clients come in and they not have proper care for their hair, good shampoo, lotion, soap. And I had to advocate for my clients on things like that. So it really goes down to the details of how you're taking care of the clients and ensuring that you're meeting the need of the cultural aspects of their need.
Dr. Johnson?
Yeah, and so just to add, you know, as Allison said earlier, you know, people like to go to others who feel that they have similar struggles and, you know, just similar, just upbringing or whatever the case may be. And I feel, you know, having more Black physicians or Black, you know, mental health care workers, that's definitely a step forward in the right direction, especially for, you know, the large number of people who are very like hesitant towards getting help. I feel that, you know, if you're already hesitant to getting help, you know, this suspicion of, you know, maybe going to like somebody who's not like you versus somebody who is an even larger barrier. And so there's a very low percentage, as we all know, of Black physicians. I keep hearing a different percentage all the time. It's whether it's like 2, 3, or something somewhere along those lines. But I think, you know, and we're starting to see a little bit more progression of that. We're starting to see, at least I'm starting to see, you know, with my colleagues and people who I go to school with, and people who I know. So I definitely feel that, you know, there's a need for, as I mentioned earlier, just more representation.
Courtney?
I can't stress the importance of this, the suspicion that people have making appointments. Many times I have patients that came and see me and they was like, oh, I'm so glad you're who you are. My name is Courtney. They think I'm a female. My name is white. They think I'm a white male, white female. So the idea of when they see somebody of color that looks like them, the amount of information that they have that they've been keeping for so long, they're able to express, right? So the importance of that is to have people that represent them. But the suspicion outside, a lot of them do not make it into an area until it's somewhere acutely ill that they need to be hospitalized, whether it be for something that was very minute that could have been addressed in an early conversation with a person that doesn't look like them. But the importance of having a person like us is the fact that they can start those conversations before it come to a point when they need to be hospitalized. It's something that's really early in input, really early intervention that can be done, can be addressed, can be worked on. And the suspicion is now there's a person that look like me, I can tell somebody else, and maybe, you know, overall, they will start to be much more active within their role to come to make sure they're making their appointments, to make sure they're able to verbalize the issues that they're actually facing so they can actually get early intervention.
Thank you so much. one of the big things that we struggle with within our own community is pride. The pride cometh before the fall, as the expression goes, right? So how does that pride, and I'm going to combine two questions in one, right? So pride and the lack of information, or the lack of wanting to get information, and a lack of wanting information, the lack of utilizing information. How does pride affect that, and also affect the mental health? So let's start with Allison.
Definitely with the lack of information. If you're coming from a family that doesn't have appropriate or healthy coping skills, you're not going to learn that healthy, appropriate coping skills unless you learn it somewhere else. And if you're not learning it in the school, or from a grandparent, or from a church, you're not going to learn it, which, will only spiral. It will only make people, if let's say you have a minute issue going on, it will only escalate it. And that's where a lot of problems do start. They start very little. And then you don't work on it, you don't work on it, you don't work on it, and then it explodes. The same thing, let's say with like diabetes, you start off with, you're eating a little bit too much sugar, then your blood sugar is a little high, they tell you to cut back, but you really want that sugar, so you keep getting it. And then now you need to be on medication, or now, you're losing feeling in your hands or your feet. And it's the same way with mental health, it just starts to spiral. And some people, they with the pride part, it's like, not me. It could be you, but it's not me. Because it's hard to acknowledge that there is what people think as a default in yourself. It's very hard to look at yourself and ask for help. It's easier for you to point the finger. So when it comes to pride, I feel like that's a huge barrier.
Courtney?
Sorry, I was on mute. Yeah. So the lack of information.
My fault.
So information is hard sometimes within the Caribbean community. All right. If you're migrated from one country to another country, the available information, we don't know. Right. So, and sometimes that pride is affecting them, as opposed to say, hey, just ask the neighbor, and the neighbor may know, to kind of aid in guiding you to where you can get the information. We hold it in. Right. So those two things combined, the lack of information. Hey, I have no insurance. Where can I go? My child or my adult person is actually having these behavior. What should I do? We have no insurance, limited income. Where can I go? So holding back is really, with the pride, is really holding back from getting that information, which eventually will cause that individual to spiral out of control.
All right, I want to thank you. I'm sorry, Dr. Johnson. The other two, I'm going to skip it just for a minute because I'm looking at the time, and we do have to get some audience questions. So I want, but there is a question, and this is going to be my wrap-up question for all four of you. And I want to thank you so much for the opportunity for you to do that. So access to mental health, right? This is all around access to mental health. And I want to, when you think of one of the major issues that cause crime is mental. Some of the things are, when you talk about people who are now incarcerated or formerly incarcerated, it's lack of the access to mental health. So how can mental health, I want to combine incarceration. We look at it, people who are formerly or currently incarcerated as well. So let's go to this question. Stigma and shame often prevent individuals from seeking treatment for mental health issues. So when this happens, how does it lead to further issues? This is going to be my last question for you. And I want to make sure that we address issues of incarceration or potential incarceration. Because if you don't address the issue, the stigma and shame doesn't allow you to address it. So even if you don't want to talk about the stigma and shame, talk about lack of addressing this issue. And I want to, so let's start with Dr. Johnson.
Well, it's when people don't, when people are faced with this stigma or faced with this shame or just very, prideful and, don't want to feel like anything's wrong with them, or they don't want to, or they want to point the finger. it could lead to, trying to find other sort of negative, unhealthy outlets. And that's a big part of the reason, you see, a lot of crime in people with mental health, and a lot of incarceration. That of course, that goes with the crime. So, a lot of these people that commit crimes, we just kind of just we kind of just classify them as, as a nation, as just like bad people. Like all these people in jail are just bad people. They're just inherently bad people. They don't care about others. They have no morals, and just all these sort of just like negative connotations around these people, when a lot of them just need help. And I feel like we as a nation haven't really looked at it from that perspective. So there's a lot of bias when we look at a lot of these individuals who are incarcerated, and a lot of these people have just found themselves just looking for some sort of outlet, but have just found it in the wrong place because they never had those positive resources, or any sort of like positive help, or they don't want to seek help because they came from an environment where that wasn't really, I guess, like emphasized for them. So I think bias is a really big issue, and I think it's all about perspective.
Thank you. Khadijah.
Exactly that. Where individuals, where their behaviors that are coming from a mental health position is being demonized, and they are ending up in the prison system. But one thing that I'm noticing here in Colorado is that we have mental health therapists that are now riding along with the police officers. So if it is a particular situation, if it's mental health, then you have a clinician come out and deal with it. If it's something that requires police officers, then they come out and deal with it. So that is one way that Colorado, I can say, is trying to end that stigma and to stop funneling individuals that actually need mental health assistance to where they actually need to go, and where individuals that actually need behavioral assistance can actually go. So the stigma, is still there, but there are ways that the community is trying to differentiate between what is needed for that individual.
Thank you. Courtney.
So, the stigma and the shame that's associated with, mental illness. You have a child that's in their late teens, going away to college, early 20s, starting their career. And we know that's when they usually have their major break, right? So now I have a child that was in college, studying whatever, being a doctor, being a lawyer, being a nurse. Now they have their initial break, that early onset, that first break that's there. The shame that's associated with that, the family tend to keep that to themselves and not really address the issue at hand. That person now spiral out of control, as opposed to early intervention. Now depends on how they, as Ms. Dixon stated, how do they now represent that trauma that they have? Do they write, or are they having physical behavior? Those outward negative behavior now have them incarcerated, right? So this individual might now be in jail as opposed to be able to get treatment continuously, now continue with their education, right? And we know that the earlier that they have a break, the more important that we need to be able to have that individual therapy, early medication onset, lifestyle modification if need be, right? They're still exposed to the trauma that's there. We may need to now remove some of that stimulation that they're actually facing on a day-to-day basis. So that stigma and that shame is always there, and it is a big barrier within our community, and that can lead to the potential incarceration of individual that could have a healthy lifestyle throughout their life.
Thank you. Finish up with Allison.
Yes, I mean, I definitely agree with everyone else. When it comes to incarceration, I really feel most of the crimes committed are committed because people have underlying mental health issues. There's not that many people that just commit crimes for absolutely no reason. They commit crimes because they feel the need that they need to support their family, whether it's stealing, not being able to cope with emotions, like, and treating it with substance abuse and alcoholism. And then when it comes to the Black and Caribbean community, I mean, there's inherent trauma, right? There's inherent trauma that white people, you know, have brought about to them. So they are born with this feeling of not being good enough. And if I reach out for help, you know, it looks even worse, you know. And the way some people are raised, right? They're not raised with appropriate coping mechanism. It's just an ongoing systematic cycle that we repeat over and over and over again. We're not giving people the resources that are needed. Jail is supposed to be rehabilitation, and it's absolutely not rehabilitation. I mean, if you've ever been into jail, I've been to Rikers and I've been to the Metropolitan Detention Center a few times, and it's they have little programs here and there, but it's not treating the problems, and the problems need to be treated within the community first, and starting at a very young age in school can help that. I mean, you can go into communities, and I mean, I feel like adults are a little harder to work with because adults are stubborn and they're set in their ways. That's why, you know, we always say like that the children are our future, and they are. The children are our future. But, you know, you need a village to raise a child. And we want to provide this village to them by giving all the resources.
I want to thank you right now for that. I'm going to turn right over to Corey because we are, you know, that be cognizant. Corey, I'm turning right over to you to look at the audience and see what kind of questions they have out there. And ladies and gentlemen, if you have questions, please put it in the chat, and then we'll make sure to ask them to the best of our ability. And if you have a question specifically for a person, put it in the chat and then they can answer that. Thank you so much. And thank you.
Thank you. Hope everyone can hear me. Panelists, I appreciate everything that you've been answering. And we would just want to try to help our those in the community that are on the program today with answering some of the questions they have here. I see Ms. Florette has the real concern here. She has a family member that's deteriorating. Well, maybe it's not her directly, but how can you help a family member that's deteriorating mentally and physically and refuses to get help? And panelists, whoever feels they have a great answer for this one, please jump in and give us an answer. Again, I'll repeat it. How can you help a family member that is deteriorating mentally and physically and refuse to get help? Tough.
Right, so one of the things is if the individual is competent, right, there's nothing really we can do for their physical health. So if the individual is able to determine their well-being, unfortunately, there's nothing we can do for their physical health. However, on the mental health side, if the individual is a danger to self or others, we can actually call 911 and have that individual on the emergency hold, right? What's called a 939 in New York, which is an emergency hold. That individual can be sent to a local psychiatric hospital. Some hospital now, what they have is called a CPEP, which is really just a temporary hold for 3 days that they're not admitted, where they're evaluated. And that evaluation can be done. And if they need to be admitted, they can be admitted then for the psychiatric treatment.
Thank you. Next question. How do you find help in a system that medicates mental health patients? This only seems to deal with the immediate crisis, a person wanting to hurt themselves, but not getting to the root of the core, no core treatment. So again, how do you find help in a system that wants to medicate someone with mental health issues?
I can definitely validate. Oh, you want that one, Alice?
No,
okay, so okay, I can definitely agree that the system is heavy on medication, but there are times where a client does need medication because it is a physical imbalance. So sometimes medication is very helpful for the clients, but you as a client can refuse or ask for other resources other than medication, right? So if you're looking for something more holistic or something more natural, you can definitely ask for those resources as well. Do not feel that you have to take everything that the doctor recommends. You can ask questions, you can ask for second opinions, but do not always shut down medication.
Signs between anxiety and different type of mental health, different signs,
Yes, Ms. Dixon, I 100% agree with you. When it comes to medication, you know, they are, it depends also what you're reaching out to the doctor for. You know, they are heavy with the medication. However, when a person's in immediate crisis, you're not going to sit there and deal with the trauma that, you know, the root of the cause, because they're in immediate danger or they need immediate help. So sometimes medication is something that's going to be beneficial. I'm not saying it always is, and I'm not saying to take it. I'm just saying that sometimes it is. You know, the same thing, I'll go back. If you have a heart problem, if you have diabetes, you know, you take the medication for that. Some people feel like the medication for mental health is extreme, but sometimes it's necessary. You know, when we're talking about the chemicals in your brain, let's say like the serotonin level, someone who has depression or anxiety, some people don't produce that or don't produce enough. And that's not the person's fault. That's just your brain. That's a brain chemical. It's just like some people don't break down sugar properly. Sometimes it's just our body. And everybody's body is different, and we have to address everybody individually. And if somebody needs medication, then they may need medication. They may need it for a short period of time so they can work on that root cause, to get them to the place to work on their root cause.
Thank you so much. Thank you so much. Moving right along, someone has a concern about their 18-year-old daughter that is in interface now, and they're discharging her to a shelter because she cannot come back home. How can I get her help if she's not voluntarily willing to get help? And more important, how can you get her into a mental facility instead of a shelter? If anyone has an answer, and how can someone get help, instead of having discharged to a shelter, but get her into a mental facility?
All right, so
this is a conversation that should have been had, I'm sorry, Courtney, with the social worker prior to discharge. Because when a patient is being discharged, there's a discharge plan that is created. So if they're discharging her to a shelter, that's because housing is needed. But you as the parent, if you want to advocate, you can ask about, is there a possibility for them to be transferred to a facility, whether in-state or out of state, based on insurance? But the social worker should definitely be meeting that need for the client before they are discharged.
Great answer. I hope that answered that question. That question. Let's see. Here's a great one. Can someone explain if the food that we eat has something to do with our mental health?
Mm-hmm.
If someone wants to,
I'll try to address that. That's a very complicated way to look at it, because mental illness is really just a chemical of the brain. So food should not really be a direct impact of that, right? So, you know, there's a couple of things that we'll look at when a person is having a mental breakdown. It's really these neurons, right? These little things that we have that's called neuroreceptors, right? The chemical how they communicate in the brain, that's where the mental issue happen, even though some of those same neurons in the brain example, serotonin is also found in the GI system, but it's really limited impact that the food that we eat will impact our mental health.
Wonderful.
Sometimes it's the deficiencies within our bodies also. So for example, like if our adrenal glands or our endocrine system and some of our levels are off in our thyroids, that can have you feeling anxious, but it's a deficiency in your body. So though the food may not directly link, deficiencies in our bodies can also lead to some of these mental health symptoms as well.
So there are some commonalities between what we eat and our mental health. It's just there's more studies that need to go into it. It's the refined sugars that we eat. Even like the lack of nutrition, that plays a huge role. I mean, if you're lacking in vitamin D, if you're low in iron, that can make you feel anxious as well. It can make you depressed because you don't get enough what you actually need. And some of the depression and anxiety symptoms feel super physical, that you may feel like you may have other health issues. Like you may feel like you're going to have a heart attack, or that your sugar's low because you feel lightheaded and dizzy. They manifest in different ways, mental health issues.
Thank you, panelists. I hope that was informative to those listening, that we got some insight on that. Someone wants to know, what is the different signs between anxiety and other type of mental health, mental illnesses, I believe.
So anxiety is really that's what's called flight or fight, right? So when we're getting that palpitation, our heart start beating a little bit more, the person is just fearful of everything that's there. That's usually, one of the signs of anxiety. As opposed to other mental illness, there's a lot of them. So is it depression? I'll read into the question a little bit. And I guess like schizophrenia, when the person now is being delusional, right? Seeing things that's not really there. And if you look at it, the same, transmitters that we spoke about, right? The dopamine in the brain, the chemical that's in the brain, if that's effective, that person will have more of a schizophrenia, right? That experience of having, detached from reality, right? As opposed to anxiety itself, when the individual knows what's going on, but is fearful due to the fact that other chemical that's there. So it could be looking at it that way. Anxiety we go through every day based on what's going on, and being detached is something that we really don't see as much, because it's really the dopamine that's really being affected within the body, as opposed to that adrenaline that we have.
And I can say anxiety can be temporary. It can be long lasting. And it also exhibits itself in everybody differently. Anxiety a lot of the times is what we anticipate will happen, and not the reality of what is happening in the moment. It's not living in that present moment. It's living in the future. So you're worried about what people are thinking, what's going to happen to me, and it's not actually staying in that moment and in that present. And it looks differently in everybody. Anxiety and depression, I can just speak on personally as well. It looks completely different, and different things is exasperated. You can have dealt with a trauma years ago. You could have went through trauma years ago and never thought about it a day in your life. And then one instance in your life, one snapshot in your current life can push all of that forward and, put you in a state of feeling anxious and anxiety. And let's say when it comes to COVID, you see a huge increase with depression and anxiety. People are fearful of getting sick. People are fearful of dying. Socially, people become more awkward and uncomfortable. People say, like, I had the vaccine, I don't have the vaccine. They're scared of what people are going to think about them, wearing a mask, not wearing a mask. So that caused a lot of anxiety as well. Every mental health illness looks differently. You can't really compare and contrast them. They're just they may overlap, right? Because, you know, there are people that are, you know, have dual diagnosis, let's say, which, you know, they have both. Anxiety and depression, I feel like a lot of time go together also. Yeah, sorry, I lost my train of thought.
But just one thing that I want to point out is we all experience anxiety at a certain level. So that doesn't mean, oh, you need a diagnosis or medication. Mm-hmm. When the anxiety or the depression begins to affect your daily functioning, you have a hard time leaving the house, you are fearful to do things that was normal for you to do, then that is a red flag that your anxiety has gotten to a point where it may be unhealthy. So remember, if it's affecting your daily functioning, then you need to go seek out some type of assistance.
Wonderful, wonderful. Thank you, panelists. Thank you, panelists. Last one here is Allison mentioned earlier about, you know, we do regular physical checkups. Should we do mental checkups, and how would we go about this?
1,000%. 1,000%. Everyone should be able to do mental health, physical. I mean, that's a great, I don't think I've ever heard that really, besides the point of like giving like surveys to people in school, or, I mean, I know postpartum, anytime you go to the doctor postpartum, they give you a survey because they want to scale you on the postpartum to see if you have postpartum depression. But they don't test you for postpartum anxiety. And postpartum, they only leave to like a year after birth. And sometimes it doesn't happen for women. I mean, postpartum can be years and years to come. You can get it at a year mark. So I definitely think it should be included in a physical. I mean, I know sometimes they have like sometimes they have like health fairs and you can get physicals there. Maybe we should start thinking about putting mental health people there also, like taking, mental health surveys to see like people's depressions, people's anxiety. That's a great start. I would love to see that.
Yeah, I agree as well. You know, I just finished my internal medicine rotation, and now I spent the last 4 weeks of it in the outpatient clinic. And usually, you know, when you're with the patient, you'll go through like what they call a review of systems, like a quick, just like they'll ask the patient, you know, do you have any fever, nausea, vomiting, like things like that. And then they'll very, very quickly at the end say like, oh, any anxiety and depression. But I think, you know, that definitely needs to be expanded a little bit more, because I feel like people don't really have a lot of information on what depression and anxiety really are.
Yeah. Because
of that lack of information, you know, I feel like a lot of people don't really have the correct answer to that question. Yeah. Or they could easily just lie about it. They can just be like, oh no, I don't. Like, just because they don't want to deal with that.
And I think the shame part comes into a lot of that also, because it's like people feel like, why am I nervous about this? Or why do I have anxiety about this? Or why do I feel sad about this? You know, there's so many people that have it worse than me. So there is that part that everybody has it worse, right? I feel like I've always heard that, even like growing up, like, oh, you think you have it bad? Well, what about me? Or what about this? So I think a lot of people, you know, don't reach out for those purposes also.
Yeah, one thing I would add with that, being when I worked as a provider, one of the things I did, and I worked in my last position was a dominantly Haitian Creole speaking neighborhood. And we do see a lot of patients that come in that do have mental issues that's not being addressed. One of the things that a clinician can do is a very quick, what's called a mini mental health exam. It is a way for us to engage with those individuals, and then the referral will be made for follow-up with psych. However, if we have a clinician and we're getting our physical, it should be something that should be a part of it. We should at least get a yearly checkup to see what's going on. If we have older adults that's there, we should also making sure that they're getting those exams. And especially if we see different changes within the elderly, we should be addressing that on an annual basis.
Great. Thank you, panelists, for everything. There was just someone was looking to reach out to have a one-on-one. I don't know if Mr. Daly, you can arrange something. They were looking to speak with Mr. Courtney one-on-one. I don't know if that can be arranged, but we have to, unfortunately, time is against us and we're wrapping up right now. I want to hand over to Mr. Nigel Thomas, the IWOF president, just to bring us to a close here today in our program. Mr. Thomas, please.
Oh boy, where do I go from here? It is difficult. It's a difficult point that I'm at. I really wish this conversation could continue. I really wish we could have it much often. But yes, time is up on us. And unfortunately, we're going to have to break this forum, but it doesn't say that the conversation is over, and it doesn't say that you won't have access to us or access to the panelists, right? So feel free to put in the chat room who you'd love to speak to. If you're still having questions, please put them in the chat room. Maybe you could put a contact in there as well, privately, to one of the IWOF charity hosts, and we could contact you and we could get you in contact with the right people. But definitely, today has been enlightening. It has been informative. I don't think I need breakfast. It's now after 12. I don't think I need lunch at this point because I am filled with all that was said. I thank you so much, Mr. Daly. Mr. Daly, I thank you so much. The panelists, let's give it up. Let's put our gratitude in the chat room. Our panelists, let's put our hands together. Let's put something in the chat room to tell them how much they have helped us today. Mr. Johnson, Mr. White, Kadisha, of course, Allison giving us that diversity today. I am so happy. I am so happy with the discussion. I'm so happy with the wealth of information that we received today. And I just want to thank everyone that made this possible. Right there is an email being placed in the chat room. I want to thank the entire IWOF team. I want to thank the technical team. I want to thank Lee Roach. I want to thank the administrator. You, Mr. Vice President, I want to thank you as well. I wanted to thank the entire village team and Mr. Roger Daly. He has his show. Feel free to find out more about that too, where you could go over and support his show on the Thursdays. We want to thank the sponsor for today, HGM Heating and Cooling. They have sponsored this pep talk, and we're also looking for more sponsors. So if you know of any, and if you'd like to sponsor the next pep talk, feel free to be a part of that. But HGM Heating and Cooling, they're the sponsors for this one, and we want to thank them so much for coming on board. Of course, we heard today the importance of addressing mental illness, addressing mental health. We see that it's something that affects the entire community. Individuals of different ages, races, families, communities, economies, and countries. And today, I hope that you see that the importance of contributing and addressing this issue, and you too could play your part. And as such, we're inviting you, please, become a part of the IWOF. You could donate to us in many different forms. I'm sure that will be placed in the chat room. That would enable us to have more forums like these. Right, it will enable us to continue to do our outreach in the communities, to continue to address mental illness and mental health. And so we're asking, please donate to us. It's the only way that we can stay afloat and continue to do the great work that we have been doing. I do ask of you to please become a volunteer. Right, you could always volunteer to assist us in whatever regards. We do have our monthly food drives, and so we're encouraging you to be a part of that, to share it, become a part of the community as well. Follow us on our social media platforms, and I'm asking you right now, find us on our social media platforms, start following us. Please make a comment, share this information that you've received. Make a post about IWOF, tag us, right? So more people could be a part of this. And so we want to thank you today. Again, I want to thank the panelists. I want to thank everyone. I want to thank you, the audience. You have been tremendous. I see the questions. There are a myriad of questions that are in the chat room. I see the issues that are coming out, many of which we can't even address in this forum. But guess what? We will be having another pep talk. And so we're asking you, make sure you follow so that you can be informed of that when it's ready and when we're ready to go with that one. Thank you so much for joining in. We appreciate you so much. Continue to follow the IWOF. Continue to be a part of this great movement. We may be small, we may be young, but the road ahead and the task ahead is mammoth, and we do need you all to be a part of this great movement, right? And thank you so much. I wish you all the best, and I turn it over back to you, Mr. Vice President.
Thank you, everyone, for joining us today. I see that you can actually catch the replay of this on Village Radio Talk Show on the YouTube channel. Please do go over there and pick up on that.
It will be posted on the IWOF Facebook page as well. So feel free to visit the IWOF Facebook page. That's IWOF Charity. All right. Feel free to visit us there as well.
Wonderful, wonderful. I also saw that some of our panelists have posted their emails for questions and concerns, as well as some links to government-assisted websites that are out there. I see some of that stuff has been posted. So feel free to take advantage of all the great information that was provided today. And please do follow us for more information and continue to support the IWF with your charitable donations. We appreciate you and thank you for joining us today. As we close off today, thank you, everyone. We greatly appreciate seeing you. We look forward to seeing you at our next pep talk. And our president will just close us off with some nice music as you take this time to run back through the chat and see if there's anything else that you can pick up from the questions and answers in the post. I'm going to close off right now with a closing prayer so that that can go with us into our day. Please bow your heads with me as we give thanks for this occasion. Thank you, Heavenly Father, for this day, O Lord God, that you have put before us. We thank you for the opportunity to come and to inform the community, oh Lord God, of what's going on in mental health and answering questions and concerns about our mental health on top of what we have physically, oh Lord God. Lord God, cover everyone that participated in this forum, oh Lord God. May you continue to increase their knowledge and their understanding, oh Lord God. Go with us as we move throughout our day, oh Lord. Blessing, and we give you thanks. In Jesus' name, amen. Thanks for everyone. Enjoy the music and enjoy your day.
Just fight a little longer, my friend. It's all worth it in the